So we've been talking about Garrett. If you've been following us in some of our other sections of the compass, we've talked a bit about Garrett and bipolar disorder. And I want to talk now a little bit about just some of the essential skills of managing bipolar disorder, at least from my perspective. Again, not an all-encompassing list, but just to give you and your Garrett some direction as you're facing some of the challenges that you're going through right now. And it's a challenge. It is one of the hardest things to come to terms with. And as I've said in some of our other little video clips, bipolar disorder can definitely be overdiagnosed, and we'll try and get some more videos out there to help you understand some things that aren't bipolar disorder, because there's a lot of those that we deal with here at the office. But I also want you to understand that sometimes it truly is bipolar disorder. And one of the biggest skills that I think is critical for Garrett and his family when I was working with them when they were younger was just helping Garrett come to terms with the reality of that diagnosis. That if that diagnosis has been made carefully and there's a strong genetic family history, it is a clear biologically based diagnosis. I often make the analogy with diabetes in the medical world, and back when I was doing a little bit of pediatrics in my training, I had an opportunity to work in a diabetic clinic for adolescents for a little while, and I'm certainly here in my practice work with lots of folks with diabetes. And most people understand diabetes, that there's type 1 and type 2 now, so people kind of understand the difference. In type 2 diabetes, you know, if you're really careful, you watch your diet, you exercise, you lose weight, you do all the things that you need to do, and your doctor wants you to do, then you can probably get off of your medications and manage just fine. But if you've got type 1 diabetes and the islet cells in your pancreas just don't make insulin, then you have to cope really well. You have to, you know, watch your diet, exercise, do all of those things, but you still have to take your insulin. And true diabetes is a lot like that, or true bipolar disorder is a lot like type 1 diabetes. And that's one of the essential skills. If we're really talking bipolar disorder here, one of the essential skills is helping Garrett learn and understand the diagnosis and come to terms with it. And that's hard. When I first met Garrett as a second grader, so we worked on that together with his family over time and helped him come to terms with it, and grappled with that at times. You know, there were times that Garrett didn't think that's what was going on, and there were times that Garrett was just like any other adolescent and was a bit rebellious and invincible and would not want to stay on his medicines, and I was willing to work with Garrett through that, and because my goal was to help Garrett come to terms with this and not just feel like he had to be on medicines because I said he had to be on medicines or because his mom said he had to be on medicines, but that he began to realize, wow, if I'm not on my medicines, I don't like how I start feeling. And so we went through some of that, especially in early on in adolescence, and a little bit in kind of late elementary. We went through some ups and downs of that. But Garrett began to come to terms with the diagnosis. And so now Garrett has really learned a lot of skills where he's aware and he tracks. He's in college now, and he tracks his moods really pretty well. And he's able to know when, oh yeah, these are just my normal moods, or this is kind of a sign of a depression, or this is a sign of a manic episode. My sleep is getting a little off more than normal, and so I need to pay attention to that, and I need to really work on getting good sleep, or I probably need to call Dr. Brad and maybe make a medicine adjustment. And so, we've worked with Garrett on a regular basis over the years and helped him get to that point where he really has developed the skills to manage his illness. And with that, he's very successful. So again, one of the key things I would want you and your child to know and to understand is that bipolar disorder is a significant diagnosis, but it's one that you and your child can learn how to manage effectively over time, and your child can be very successful and productive as an adult with bipolar disorder. So hang in there and give us a call if we can help, and we will come alongside and walk the journey with you as well.